Hi, my name is Aletta Marshall. I'm doing a short presentation on the causes of dysfunctional behavior and the learning theories used in counseling that may apply in dysfunctional environments. Families are supposed to be the building blocks for society, people we can rely on in tough times, people that love us through trials and tribulations. Firstly, I'd like to discuss some typical characteristics in dysfunctional families. Addiction. According to the 2019 National Drug Survey, an estimated 9 million people, that is about 43% of people aged 14 and over in Australia, have used illicit drugs at some point in their life. About 59,100 children are in care or on protective orders. Addicted parents have a negative impact on the family and the finances and the cumulative or connective responses of a child, as well as the child's relationship with others. Next is perfectionism. When perfectionism is highly regarded by parents, a parent would try to live out their lives through unrealistic expectation in the children. This children will often grow up with low self-image and self-esteem issues, thinking that they never be good enough. They may also develop trusting issues and they may feel their parents do not regard them individually. Abuse. Abuse is another common characteristic of dysfunctional families. Abuse is used to punish unwanted behaviors or for the parent to feel that they are in control. Unpredictability and fear. Unpredictability and fear goes hand in hand. This type of abuse is often because financial or emotional instability. Children that grows up in an unpredictable household suffer from low self-esteem issues. They may grow up to be people pleasers or end up mirroring their parents' behaviors. Unpredictability and fear results from over-rigid or religious upbringing, where a family does not allow the child to form their own beliefs and aspirations and interests. Next, conditional love. When a parent only gives love when they want something from the child. The next one is lack of boundaries. When a family does not establish healthy boundaries, members often feel like they have no privacy or they're not respected. Parents who see their children as trophies or extensions of themselves are narcissistic and cause them to feel confused about their own identities. A lack of intimacy. Dysfunctional families often mistake codependence for intimacy. The next one is poor communication. Overall, dysfunctional families do not practice good communication skills. So members can be quick to react or be aggressive. These challenges tear families apart. Now I'd like to discuss 3 learning theories in which counseling may be applied in dysfunctional environments. Behaviorism. Behaviorism is the learning theory that is not interested in thoughts or in the mind, but in the analysis of the actions or reactions, believing that psychology should be based on facts and what we can measure, saying the environment determines who we are. Therefore, it describes behaviors as result from conditioning, where when treating the psychological disorders, you change behavior patterns, not the thoughts. Skinner said psychology should be empirically based, that both the environment as well as genetic disposition influences behavior. Operant conditioning is where the learning process is likely to change when one can apply positive or negative reinforcement every time the behavior is exhibited. So the subject can associate the pleasure or displeasure of the reinforcement. Behaviorism assumes that emotional and behavioral disorders are the result of inappropriate learning. Therefore, the most effective way of preventing a challenging behavior is not to reward the undesirable behavior. Cognitivism, Alice founded cognitive behavior therapy. This model of therapy stresses the role of thinking and belief are the root of all personal problems. Cognitive therapists believe that distorted thinking causes distorted behavior, and that correcting the distorted thinking will cure the distorted behavior. Constructivism is another learning theory in counseling, which the learner takes an active, constructive approach to learning. It results from mental constructions, whereby the learner construct their own understanding and reflect on their own experiences. And this is often reflecting on their own experiences and things they already know. Behavior therapists, in contrast, view distorted behavior as learned from experiences and attempt to challenge the distorted learning by replacing it with more adaptive ones. Many therapists combine both techniques, which is called cognitive behavior therapy. In terms of behavior as a result of a dysfunctional environment or outcome, some things that we can change by learning new things. And combine these two theories, both behaviorism as well as cognitive behavior. That's therefore called cognitive behaviorism. In terms of behavior as a result of a dysfunctional environment, outcomes, some things that can help to change the resulted behavior can include identifying painful or childhood experiences, making a list of behaviors and beliefs that the client would like to change, helping the client to come up with alternative behaviors and beliefs that they would prefer, and selecting one of the items on the list and begin practicing alternative behavior and beliefs. And then once they've mastered them, then they can choose one and start again. In conclusion, children grow up in dysfunctional environments, and these children often struggle with unwanted behaviors. When they grow up, if they want to change these unwanted behaviors, they often need some psychological help or counseling. Thank you.